Jesus, all the way. I'll forever trust in you. Jesus, all the way. JC247.
No, I can't hear you. Can you hear me? No, speak up, please. Has this ever happened to you? You're trying to understand what people are saying when they're speaking with you on the phone and they're just not speaking loud enough. Or is it my problem? Is it that I can't hear them when they're speaking? Am I becoming deaf? Well, how can you know if you can't hear me now? Well, I have good news for you. We have on set here 2 otorhinolaryngologists. I hope I got that correctly. In the person of Dr. Ashraf and Dr. Ramprasad. We are happy to have you here. Otorhinolaryngologists, otherwise known as ENT specialists. Yeah. I prefer to use that one. That's much easier. Dealing with the ears and the nose and the throat.
That's correct.
Right. The first question I therefore want to ask the both of you, any of you, is why the combination of ears, nose, and throat? Dr. Ashraf, I think you can answer.
Well, if you look at the chart that we have up there, you see that there are spaces in the bones, the facial bones, and they all communicate at one point or next. So therefore, you can't separate them into air, nose, and throat. It has to be together. And the pathology is almost the same in every case.
Okay.
But there's one thing that you should know, that the ENT, the otorhinolaryngologists, are now head and neck surgeons.
Okay, head and neck surgeons.
So there's an added onto it.
Okay.
And a lot on our part, on our jobs. Harder for us.
Oh, my.
Head and neck surgery.
Okay, so you have much more to study, much more to combine and stuff, but I'm sure you guys are well equipped to do that. Dr. Ramprasad, what is it that, what are some of the common diseases affecting the ear? We will start off with the ear in ENT. What are some of the common diseases affecting the ear?
Well, the ear can be affected by a number of things, ranging from the very simple to the more complex. And again, referring to the chart that we've brought, the ear is comprised of 3 major portions: the outer ear, the middle ear, and the inner ear. And any part of that structure can have a disease of its own. Sometimes the more common things are things such as, like you mentioned, deafness, either a rapid onset or a gradual onset, caused by many different problems. So if we take that as an example, deafness, it can be caused by an obstruction of the outer ear canal, some damage to the ear canal or eardrum, perhaps some fluid in the middle ear, or perhaps a problem with the sensory part of the ear, the cochlea. Even further on, it could be the nerve that runs from the cochlea, the inner part of the ear, to the brain. So that could be any of the possible causes of reduced hearing. There could be problems with infections of the ear. There could be structural changes that develop as you progress in life. It could even range to the more serious issues such as tumors in the head. So there's a wide range of ailments that can affect the ear, from the very simple to the very complex.
I suppose there are treatment and cures for most of them?
For most of them, yes. There would be some sort of treatment. Even for the ones that there aren't treatment for, there would be some sort of management. If there's wax in the ears, you can have it removed quite easily, either by syringing or suctioning. If there's damage to the eardrum, it can be rectified surgically. If there's glue air, we can drain the glue. If there's a problem with your hearing because, well, you're no longer 25 years old, you might be able to have a hearing aid put in. So there's always something that can be done, but the best way to find out is to find someone who knows about it and have them look at you.
Dr. Ashraf, I learned that, and Dr. Ramprasad alluded to the fact that, you could help clean the ears and stuff like that, but I've been told that we ought not to put certain types of objects into your ear, like Q-tips and stuff like that. Is that true?
The Q-tips have the problem of falling out. So if you take a Q-tip and put it in the ear, and then you take it out, sometimes you don't observe that you've left that part in the ear. That's the most common cause, but the other time, kids usually put things in the ear. It's a habit of them to just keep putting things in the ear. So it's difficult for us, because if it's not wax.
Right.
Then you have to look down and suction it out.
Right.
It's very dangerous to take things and try to dig it out.
Okay. But at the Rampasad, sometimes, I mean, come on, the itching is unbearable and it's tempting to just put some cotton or use your hand and stuff like that to deal with it.
Like I always say, one of my consultants used to tell me the only thing you should put in your ear is your elbow. Meaning, obviously, you shouldn't put anything solid in your ear. If you think there's wax in your ear, you can put some wax dissolving drops of olive oil. If you think there's a problem with some dry skin around the ear canal, you could put some moisturizing cream. But the best thing you should really do is have someone, again, look in your ear.
For scratching, for itching?
You don't know what the cause might be. It might just be some dry skin, and some moisturizing cream would deal with the itching problem. But what if it's an outer ear infection and the itching is merely one symptom that might develop in a couple of days to discharge from the ear canal? Best way to find out if something is bothering you for a prolonged period of time, have someone look in your ear.
But there's some liquids that the drugstore would sell. You could also
Yes,
use
there's a problem with wax.
Right. Wax
So softens the
remover and
back.
softener. Okay.
Yeah.
Okay. When we say something is too loud, what are we actually saying?
Well, it's the decibel range outside that it's annoying you. Normally, we hear between 0 and 30 decibels.
Right.
If you hear 100 decibels, I mean you're hearing something like a tenor pan. A tenor pan.
Okay, but Dr. Rampasa, would it range from person to person? Would I consider something too loud when you are saying, hey, that's just the right level?
Yes, it also depends on your sensitivity to sound, your exposure to previous sound. It may be that what you consider comfortable, someone else considers uncomfortable because their capacity for sound is at a greater range. So it's actually utilized in the UK now, and I think it's spread across the world, where there's a certain machine that emits sound at a particular frequency that only children can hear. So it discourages children from below a certain age from hanging around certain shops. So cigarette shops would project this sound that prevents teenagers from being near it, and adults can't hear the sound because you've lost that particular sensitivity to sound. So yes, different categories of people have different levels of hearing, and also your exposure. You might be tolerant of heavy bass music in a fete, whereas somebody else might prefer the symphonies of Mozart played at a low level. So it really depends on your particular capabilities, your genetics, I suppose, and what you tolerate. And then plus, some people, as they get older, they can't hear very well, so they'll be able to tolerate loud noise. Someone will be shouting at them and they can just barely hear you. So yes, what one considers loud varies.
I do remember in my time when I was fetting, there were times I would stand behind a box and it would be very loud. And of course, after the fet, you go outside, you talk to people, and they have to speak very loud for you to hear. What accounts for that? Is it that I might have been conditioned to hear it only loud?
No, I think what happens is there's several things. When you're in a fete, you're drinking, I think the appreciation of sound differs.
Okay.
Yeah?
It's amazing.
And it comes to a point where that you can tolerate it. But when you get at home, there's a muscle that holds this one of the bones, the stapedius muscle. And when that goes into spasm, you'll hear the same ringing. And you're off the fete and you're walking down to your car. You hear the same buzzing. Sometimes it takes a little longer time to adjust. So you have to relax that, get that muscle relaxed.
I'm sure you would have heard this old adage growing up: stick brick in your ears, they can't hear me too well, and that kind of thing. But the truth be told, could there be foreign objects entering your ears without your knowledge?
Yes, quite commonly, actually. Sometimes it's something that's put in by the person. Children will stick beads or pieces of paper in the ear. Sometimes wax can accumulate and either block the ear canal on its own, or you shove a foreign body inside the ear to try to get it out and make it worse. Or sometimes insects can go in the ear. It's a nice warm, moist environment. It's dark, and insects love that sort of thing, and they'll go in.
Like mosquitoes?
No, larger. Cockroaches and recent note, a centipede.
You said cockroaches, isn't it?
Yes, cockroaches. Beetles.
You mean the small little ones there?
No, the full-size cockroaches
Cockroaches?
sometimes go in the ear, and other insects.
Unknowing to the person?
Well, they know when it's in there.
When the cockroach wants to get out.
Okay.
He's eating,
For a few minutes they would have gone in there, I suppose.
yeah, but they go in, I think, for the wax too, huh?
For the wax.
Yeah.
They got to get it out. This is ridiculous. I don't think I've ever heard that before. Cockroaches in somebody here. For how long would the cockroach have been there?
Well, it depends on the person. Sometimes it might be someone, as soon as they feel something going in the air, they come straight to the hospital. Sometimes they might be asleep and felt something in the air and just, scratched the air and left it alone, and then the following morning the pain sends them to the casualty. Sometimes they might not be in their right mind and might not come until a couple of days later.
That has to be I think that might be the last one. That last one, it can't be. It's very difficult. I'm sorry. But the cockroaches, what else do you think, or what else have you discovered lodged in somebody's ears?
Various insects. Like I've said, most recently a centipede.
Okay, let's move on, please. How are we able to smell, the capacity to smell? And how is smelling linked to taste?
I'll take that one then. The sense of smell is governed by what we call the olfactory bulb, which is at the very top of the nose. As you can see in our diagram there is the olfactory bulb, which sends down nerve fibers along the walls of the nose, and as air laden with vapor particles or whatever chemical that's representative of that smell floats through the air and enters your nose, it stimulates the nerve fibers that sends an electrical signal to your brain, at a certain part of your brain that is termed the smell or taste center. Incidentally, as I've said, it also governs taste. So taste also sends, the taste buds also send electrical signals to that part of the brain. And as the two signals combine, it gives you a flavor picture of what object it is. So as a result, it gives you a prelude of what object is coming in via the smell, and then the taste center confirms what it is. So sometimes the smell actually allows the brain to realize what's coming in. It prepares the mouth as you salivate, it prepares the stomach, and so that you're ready for the meal, and it tells you what's good and what's not. Okay. So you might avoid something that you know is dangerous, and your mouth might water when you realize something that's very tasty coming along.
Okay. I'm talking here with doctors Ashraf and Rampersad as we look and examine ENT, the ears, the nose, and the throat. Believe it or not, you know that cockroaches can live inside your ears. Believe. We just have to come back and we continue our discussion on ENT. Stay tuned. We'll be right back.
I'll forever trust in you. Jesus all the way. JC247.
If you are wounded, and if you're alone, if you are angry, if your heart is cold as stone, if you have fallen, and if you are weak, then come find the worth of God that only the suffering seek. Come lift up your sorrow and offer your pain, and come make a sacrifice of all your shame. There in your wilderness, He's waiting for you to worship Him with your wounds, for He's wounded too. He has not stuttered, and He has not lied when He said yet come unto me. You're not disqualified if you're heavy laden. You may want to depart, but those who know sorrow, they're closest to His heart. Sing with us. Come lift up your sorrow and offer your pain, and come make a sacrifice of all your shame there in your wilderness. He's waiting for you to worship Him with your wounds, for He's wounded too.
Forever trust in you, Jesus all the way. JC247.
Otorhinolaryngology is our study for today as we examine how the ears, nose, and throat interrelate and how we can better take care of them. And we have in set here Doctors Rampersad and Ashraf. I just want to get into the idea of agousia and anosmia. I think I got it correctly. What are these two conditions, anosmia and agousia?
Well, anosmia refers to the absence of the sense of smell, and agousia refers to the absence of the sense of taste. And like I've mentioned earlier, the pathways for the sense of smell and the sense of taste eventually end up in a part of the brain that controls both the sense of smell and taste. So anything along either pathway that interrupts the recording of that particular sensation would cause anosmia or agousia. It's more common, however, to have hyposmia and dysgeusia, so where you have a reduced sensation of sense of smell or taste. And a number of factors can cause that. Let's take anosmia to start with. If there's a reduced ability of airflow going into the nostrils, say the nostrils are narrowed, or you have a cold, or you have a lot of mucus in your nose, or you have polyps in your nose, or anything that blocks the airflow going up into the nose to the olfactory bulb, that can cause hyposmia. It might be that you're exposed to chemicals, and perhaps it's damaged the lining of your nose, so it's no longer sensing the vapor particles that represent a particular smell. It might be that the olfactory bulb is damaged, or the nerve pathway to that portion of the brain, or maybe there's a problem in the brain. Maybe there's a space-occupying lesion that's causing the problem and stretching the nerves. Similarly, agousia or dysgeusia can be caused by any problem starting with the surface of the tongue or the taste buds that lie within the material of the tongue, perhaps the nerves that run from the tongue to the taste center in the brain, perhaps again the taste center in the brain. Sometimes they combine. Sometimes one can cause the other. If, say, you have a blocked nose, you can't really taste very well quite often, and there's quite a common test that's done, especially for doctors, where you can actually check how you do it, where you're given various vials of different juices. And you block your nose, and you sometimes can't tell the difference between orange juice and apple juice if you close your eyes, or the difference between a piece of potato and a piece of apple, because they have a similar texture, but the taste is married with the smell, and so the flavor profile isn't there, and you sometimes can't decipher which is which without both your taste and your smell. And as such, that's why chefs have to have a good sense of taste and smell, and cigarette smoking is a definite no-no for chefs, because you destroy your sense of taste and smell conveniently with cigarette smoke.
You're kidding me.
Yeah.
Okay.
So if you want to really have a good sense of taste and smell, you have to make sure you preserve those two items.
Okay. So you have identified a taste condition or tongue condition, if you like, and then you have identified the ear condition. What about the throat, dysphagia or dysphagia? Is that how you pronounce it? What is that actually?
That's a condition in which people feel there's something wrong. It's when they swallow. Now, the thing about it is that in most of our studies that we have done, especially when we scope them, we have found that there's a great thing of reflux. See, when you have the larynx, there's a flap anteriorly that flaps down, closes the larynx so that the food could pass.
Right.
Now, the reaction to that flap, to closing, when the food is coming in a different direction, because the food has to come from the stomach.
Right.
When it comes up, the flap is not able to close quietly down. It lets a little bit of the acid in, and you get a hoarseness and an uncomfortable feeling.
Okay. Let's get back to the nose, because that's the throat part of it, but the nose. Why is it that when you get influenza, you suffer from stuffy nose? What's the relationship between that?
Well, influenza, like many viruses, especially the rhinoviruses, will cause an inflammation of the lining of the nose. And it's more the rhinoviruses that cause it rather than the influenza virus. But the influenza virus would also do it. It causes the lining of the nose to become edematous, swollen, and it produces a lot more mucus. And then too, it also suspends the beating of some microscopic hairs in the lining of the nose that are called cilia. And that also contributes to the mucus production and mucus retention. And like with all viruses, unless it's causing you anything more than a stuffy nose, you let it burn itself out. And Vicks inhalers are not something that are intended for long-term use. If you suspect that you have something that's persisting, then you might need to be put on a various combination of treatments, depending on whether or not it's an allergic rhinitis or some other nasal condition. Again, if you think you have a persistently stuffy nose and it's more than just a cold, have someone have a look at it. Have someone look up in your nose, maybe pass a scope if necessary.
Speaking of allergic rhinitis, why do some people suffer from allergies and others don't?
Right. Well, normally, people, when you come out and you're facing the environment, there's certain things that your body doesn't agree with. For instance, in ordinary stuffy nose, you come out and the glands react. A reaction obviously takes two forms. When you call it an antigen that you're allergic to, it gets to your body. It reduces the cells of your body to produce a mast cell, which then produces a histamine. So you see the pharmacist telling you, take an antihistamine. So you're taking something that will help you decrease the reaction. The runny nose, the scratching, the itching. You see that frequently.
So is it genetic, therefore?
Well, some families have it passed on. But most likely at the age of 3, 4, 5, you have an idea of what you can react to or not. If the reaction is missed in the nose, you pick it up in the chest, and you get what you call asthma.
Are all allergies permanent or long-lasting?
Yes and no. Allergies are things that you overreact to, and you can actually reduce your reaction to it. There are therapies where you can manage it by suppression, such as steroid therapy for the nose and antihistamines. But for certain allergies, you can actually desensitize to it. For example, as is pretty well known in the field of allergy medicine, grass pollen has now a treatment for it, where you have small tablets of compressed grass pollen that you put under your tongue on a regular basis, and after a number of months to years, you become desensitized to it, so you're no longer sensitive to it. And there are other desensitization therapies that are being introduced for various other allergies. The first one was just grass. So there are ways you can get over your allergies, and you can outgrow some of them. Some you can't, some you live with, say like a peanut allergy, or maybe you're allergic to your cat. Sometimes avoidance is the best way. Sometimes management is the best way, and for some there are treatments.
What part does salt water play in the curing, not necessarily of allergies, but maybe other types of infections in the nose?
This is where free treatment you can send them to this, you see. The thing about salt water, it has the effect of cleaning out the area of the nose, and it has also to encourage the growth of the cilia back. So normally influenza viruses, and as they mentioned, will damage the glands and the cilia. Salt water effectively cleans it and encourages the growth back. And it's obviously the cleansing. You can see when somebody go and bathe in the sea, the second thing they do is they blow their nose.
That's something God would have planted or put there for all of us to benefit from.
It's
So
free.
we can avoid free.
Quite conveniently, it surrounds the entire island.
Okay, that's easy. So what I mean? We can avoid going to the drugstore and maybe even a trip to your house, to your office. I don't know. But speaking of which, how often should we visit the ENT office as we come to a close?
Well, it's not necessary to regularly visit your ENT surgeon, but if there's something that you're not sure about, obviously you go see him. I mean, for general health, you probably should be mindful of your own health and be aware of various things that you should look for, which I think is the main thrust of this series. So I think if you have the knowledge and you suspect something is going on, have someone to have a look at it.
Okay.
And if we can help, we'll happily do so.
I'm sure you would. But are they, sorry.
At the age of 50 and over, I suppose, and here audiogram might be advisable.
Okay, so I still have some time then. What sort of foodstuffs do you use or consume to aid in the maintenance of good hearing and balance and stuff like that?
There's the diet sheet is anti-reflux diet. Usually the things like cabbage, where we eat a lot of Chinese food. That encourages reflux of the food. Things like that you have to avoid. Obviously, you're not going to eat fast foods also, cholesterol content. So although we're dealing with the face and its bones and the structures and the drainage and everything else, we have to also think of our heart.
Okay, beautiful. But Doctors Ashraf and Ramprasad, thank you for taking the time to be with us today. I'm sure we only touch the tip of the iceberg when it comes to the maintenance of the ear, nose, and throat, but you would have stimulated us enough for us to at least be mindful that these particular organs are very vital in keeping us alive, keeping us healthy, keeping us well. But more than just the physical ear, nose, and throat. Remember, God has given us a spiritual ear. Some of us could be running the risk of having ears but don't hear. As one man rightly said, he is not so blind as he that will not see. And perhaps it's true for the ears. He is not so deaf as he that will not hear, but will not hear the voice of God. Can you hear him now? I can. He's online right now. See you next week. I've got to take a call on JC247.